undervaluation can be only insult, right? Only a low confidence level. But if it is syphilitic, ulcers developing, this has to go to the syphilitic level. So miasms will change the emotional pathology as the rule, and even the repertory, even the rubrics will change from here, right? So when you're talking about the history of the womb, we have seen this womb has got the tremendous capacity. Now, as we all know, the structure, what I'm trying to tell you is कि first try to understand the disease, because body never lies. What we say, totality of symptom, it is nothing but reflection, the outwardly reflection of what is happening inside the vital force. You cannot go and enter the uterus, right? But the symptoms, the sign which the vital force throws onto you, you can see that, you can feel that. So all the signs and symptoms, they guide you. Yes, this is the section which is affected. This is the disease. This is the section affected. Like if I tell you, I'm having vertigo with some rumbling hearing, ringling in the ears, you directly say this vertigo is because of ear. If I say my BP suddenly shooted up and now I have got vertigo with slight weakness of my left side of the body, you will say that the central nervous system is affected. So every tissue, every organ has got its own function and nothing is useless in the body. So even the uterus is planned, designed in such a way it can function. When you talk about ovaries, it is the identity of the female. So all the ovarian conflicts will go to the sexual identity, because without ovaries, you don't have any identity. If you talk about the fallopian tube, they are the messengers. This is the place where the universe has its own beautiful plan of conception. This is where the fertilization takes place. And before the mother is even aware that she's pregnant, the cellular division takes place. So this is the transportation unit and also the most secret plan conductor, as humble, like just the most important planners of our body, right? Then you have uterine wall. So because the uterus has the capacity कि हमको single unicellular, uterus is usually not felt, but it has the capacity to grow and incorporate the huge fetus which can grow to the huge size and complete human machine which is getting evolved. So it has to have a dense muscular tissue which is nothing but the myometrium. The body of the uterus, the fundus, you know that this uterus is into the pelvic cavity. So lot of ligaments which are hanging, because they cannot just hang in the purse, but they are in the pocket of the abdominal cavity. The viscera, they are being covered. So you have and definitely when the uterus is growing, the child is growing inside. So the endometrium gives nourishment, and there is a cervix and vaginal part. So when you talk about all these tissues and organ, so you have to understand how this tissue is made up in the body and how this tissue functions. We will take each and everything. As we know, uterine fibroids are divided into different parts. There are intramural fibroids, there are subserosal fibroids, there are submucosal fibroids, there are cervical fibroids, there are pedunculated fibroids. So there are different nomenclatures according to the place where they are identified. So as we all know, key body doesn't lie. So there will be frequent signs and symptoms which the body will throw that yes, these are the symptoms ki a fibroid can be there. So the menses, they get disturbed. There are heavy and painful menses. The pelvic pain and pressure is there in the body. There is frequent urination. If it is an anterior fibroid, a huge anterior fibroid usually pushes the bladder, and because of which they often feel that sensation that they have to go to urinate. Constipation, yes, because of the rectal pressures. The lower back pain, because the muscles and the ligaments, they are getting pulled because of the pressure which they have. Even there is dysmenorrhea, because the musculature have to now contract more. There is a lot of pressure on the muscle of the uterus. So they contract more, giving more pain. Definitely, because of heavy menses, the person can have anemia, and definitely huge fibroids can also affect Even if it is a cervical fibroid obstructing the vaginal canal or the cervical canal, it can affect the reproductive system of the bud. So as we now come to endometrium. So what is endometrium? As we all know, it is the inner lining, innermost lining, and it is the most critical player of reproductive system. As we also know, when we talk about fertility, the first thing comes up is the endometrium good? When we talk about ovulation, if even if it is a good ovulation, but the endometrium is very thin, not ready to implant, not ready to catch hold the zygote, the abortion happens even before the mother is known to it. So endometrium gives that root, give that soil. So we are talking about root, we are talking about the soil, we are talking about nourishment to the developing fetus, right? So endometrium helps the placenta to go deeper. Endometrium helps the to go and take its nourishment. The endometrium is rich into the blood supply, right? So when we are talking about endometrium, the function of the endometrium is to give nourishment to the baby. It's very important in childbirth because it's nutrition. It's important to have a good endometrial blood supply so that it can give a growth, good soil. Endometrium is equal to the soil and nourishment, right? It is the nest where the baby is growing, the womb where the baby is growing. It's about me and my progeny. So that is talking about the family. So it is the nest where I and my family grow. It is where we are connected to each other. The bond with the mother and the child is something, the bond which could not be broken up. There is a new theory which talks about the cells of the mother and the cell of the child. When the child is in the mother's womb, there is a cross connection of the blood which is going from the mother to the child and again the child to the mother. And because of which few cells they remain permanently inside the mother, and because of which the child and mother, that connection, that bond cannot be broken even after the separation of the mother and child, that is after the child. So that is the connection. And therefore when we are talking about any disorders, even after the child is born, even after the child is grown so big, still the bond of that mother and child is there, and therefore these causative elements need to be given importance while taking the case. So we are talking about motherhood. We are talking about that feeling the mother carries for the child. So when it comes to endometrium, you're talking about lot of nourishment, lot of diseases. So endometrium is a disease. Sorry, endometrium is going to second layer, right? Endometrial fibroids are going to layer 2. So when a mother talks about that, am I not able to give nourishment to the child? I feel that the people around me are very torturous to me and I'm not having that sufficient nourishment. कल जाके हो सकता है because of poverty I won't be able to nourish the child. Am I not capable? So that fear of starvation, the fear of starvation to the child, a fear that I am incapable to give a good nourishment. I am insecure that my child might be taken away from the society. So I want to give more nourishment. So what is a fibroid? Is an overgrowth. So the demand is कि I have that insecurity, I have that fear. So I need to grow because I need to proliferate. My cells are not sufficient enough to give this growth. I want to be a mother. I want to be a motherhood. But recurrent abortions are not letting me be a mother. So, ठीक है, if I don't become a mother, let my womb even experience this motherhood. So, even fibroids develop at that time where they have that instinct desire to become a mother. There also they can have a uterine fibroid, that is spatially an endometrial fibroid, because it's a delusion level कि I pseudo pregnancy, at least I can grow I have that incapability to grow. I have that incapability to give nourishment. Because of that fear and insecurity, let my cells grow as a reaction. So I'm not able to give nourishment and care to my children. Am I inefficient? Am I timid? Am I low confident that I won't be able to give that love to my child? So indifference to her own children will come over here, right? Because that thought process, ki I don't have that love for my child, will give you endometrial fibroids, right? Are you getting me what I'm trying to connect and the way we are connecting? Endometrium is related to nourishment, and nourishment is the basic need, that is love. So endometrium is connected to that love, to that bond between a mother and a child, right? So endometrial fibroids are due to that insecurity. We saw what happens when a cell goes at the insecurity level. It proliferates, and in psychosis there is lot of, so if I have recurrent abortions, what happens if I'm aborting many a times? That abortions will create some injuries at the endometrial level, that recurrent DNC, recurrent hormonal medicines which are taken by the patients, and I don't want a child, I just want to reject. So those recurrent injuries will definitely lead to a lot of fibrin deposition and leading to proliferation psychosis and the synthesis psychosis. So now you can connect the thread from psychosis leading to the pathophysiology of the disease and the mind at the cellular level, right? So endometrium is related to nourishment, so nutrition and care to the children. Am I sufficient enough to give the child? And endometrial fibroids, I will tell you, have got a capacity that they can be in multiple seedlings. You will see that a USG says there are multiple seedlings which are seen. Endometrial fibroids bleed a lot. They give you an intermenstrual bleeding also. Endometrial fibroids can also threaten the fertility issue also, because because of the endometrium fibroids, they don't allow the zygote to implant, so they threaten implant. So they are related. When you see in the history that the mother had recurrent abortions, and now you will see that yes, they will have endometrial fibroids. And sometimes in the USG we see that they were in many numbers, and over a period of time those seedlings have gone. So they form, they come and they go, right? So this is what the whole process of endometrial fibroid is. So they want to proliferate in number, and therefore you see endometrial fibroids can be more in number. They are pedunculated also, because they just drop down into the uterine cavity, and you find those endometrial polyps also which are there. Even they can just enter from the endometrium and go to the cervical canal also. So they want to give more space now. Why I have to proliferate? So that I can give. What is my need is I want to give more love. I want to give more nourishment to my baby. And I know okay, my womb is inefficient enough. So I want to give more space. And if I want to give more space, I need to proliferate. I need to go into hyperpsychosis. So this is nothing but endometrial fibroid, right? So when you talk about now submucosal fibroids, they are also, we all know that endometrium has got different capacity, different layers. So below the endometrium, there is myometrium that is full of muscular tissues. We'll see later. But in endometrium, there are a lot of uterine glands which are embedded, and there is a glandular system which is functioning, which helps you to lubricate the whole uterus, right? And that excess liquid is also known as leukorrhea, which is very normal. During ovulation, it gets simulated. Before menses, after menses, you see that leukorrhea varies. So these submucosal glands which are there. So when I feel that there is friction, mucosa, we are talking about lubrication. I'll go. So interlining, which is for lubrication. So glands which produce lot of mucus. The function of the mucus is to lubricate, right? So what happens is, why this lubrication is there? And what happens if these normal cervical secretions or the uterine secretions are not present? As we all know, there is a particular flora or the acidic level or the pH level which is to be maintained, right? And if this is not there, if my secretions, my vaginal secretions, my saliva, all the secretions which are there at the neuroectoderm or just near the opening of the body to the outer surface, they maintain their own pH. So this mucus also helps in maintaining the pH. So something toxic will enter into the body and just destroy the whole tissue and the organ. So they need lot of mucus which is there to be lubricated, because it is even required during the process of copulation, because the friction might give injury. So you need a lot of lubrication. So when you talk about submucosal fibroids, there is something you're talking about defense, right? You're talking about something defending, right? Something avoid the friction. So in form of leukorrhea, right? So you're talking about lubrication and you're talking about friction. Now you have to understand one more thing is, there is difference between endometrium and myometrium. So endometrium, sorry, I forgot to tell you, submucosal fibroids, when you are talking about frictions, right? Submucosal fibroids will be when you find in the family, there are a lot of conflicts and lot of quarrels which are happening. And because of which the mother doesn't want all those things to happen around her, and she just avoids them, and she doesn't like those. It's not a major quarrel. They are the small things which are hampering, and everything becomes surrounding her is more acrid, right? More acidic. So these mucus maintain the pH also. So they are to avoid that lubrication, sorry, to avoid that friction. So when there are quarrels, fights, you will see submucosal fibroids. So endometrium, as we see, they are the mucosal thickening, simple columnar epithelium, 3 layers, and they are continuously into that cyclic changes, and therefore endometrial fibroids are really very easy to treat also, because they are the most dynamic layer of the uterus. So when you give a right simillimum, within months, within days, you will see that the polyp, the endometrial fibroids, they just go, and they can also increase in numbers also. But what about myometrium? Is the middle layer. It's made up of smooth muscles. So when we talked about endometrium, it was talked about the connective. It is more about the implantation, nourishment. But when we talk about muscles, they are responsible for the muscular movement of the uterus during parturition. So they help in the push. They help to support the uterus. They help the uterus to grow so much and support the growth of the baby. So as we know, these myometrial layers, they are as a support structure. They are the connective tissue of the uterus. They help them to grow. They protect them as a wall. It's a wall of the uterine cavity, right? So they are walling it off. They are to support. They are to strengthen. Muscle fibers over here are in 3 layers. They are outer, middle, and inner, so that it's so much densely coiled with each other, they can really expand to that level. So definitely when you're talking about connective tissue, the layer of myometrial fibroids will go to layer 3. So is the middle smooth layer of the uterine wall responsible for muscular movements. It's very important during the childbirth. It helps into contractile movements of the uterus during childbirth. Nowadays, you have seen ki, when we talk about myometrium, that comes to my mind is ki every time before, what used to happen is ki the mothers were really efficient enough to give birth, right? There were lot many normal deliveries. Normal delivery used to be a normal process. Now, normal delivery has become an abnormal process. Why? Because myometrium plays a very important role. This is the connective tissue of the body which helps in expulsion of the uterus for the uterine contractions, and the baby is pushed out. But every time since birth, nowadays girls are being treated that you are inefficient enough. the devaluation exactly to the femininity, that you are incapable enough to bear the responsibility. Before it used to be, once the puberty has attained, they got married, and before the uterus was going into the secondary changes due to age, the mother used to complete her whole cycle of motherhood, giving birth to the child when the fruit, the uterus was very ripen enough, very initial phase, and before she could understand what her identity is, what the identity crisis that I before that I developed, she would complete her motherhood, right? And they were told, you have that capability to give birth, you are born to give birth to the child, and this mother nature has given you the capacity to give birth. There used to be 8, 10 children in a family, right? Because they were told like that. But nowadays, a pregnant mother is being treated as someone who is being diseased. Normal things have become so abnormal that they undervalue themselves. They feel that they are incapable enough to carry the child. They have, starting from fear of responsibility, ki am I, to the level of infertility, if you say, कि they have that thought कि I am incapable to bear a child, I am incapable to push the baby, that fear of death, the fear of delivering a baby. I had seen a friend of mine who had that fear of suffocation. She used to say कि I, that thought also, that the child will pass through that vaginal canal gives me suffocation. So all those have led to so many changes, and the normal deliveries have become so abnormal now. So they cannot push. So these muscle fibers, they fail to get that strength to bear the child and just push it out from the womb. 9 months, there are so many complications nowadays that they cannot hold. The inner circular fibers, which are near the cervical os, I will take when we talk about cervix, that what happens nowadays. So when the child is born as a female, she feels ki I am incapable, I am not responsible, I have that fear of responsibility now. I am immature enough. So all those thoughts of immaturity, all that leads to that connective tissue, that is devaluation conflict at the myometrium level, leading to those delayed labors, prolonged labor pains. The uterus get exhausted but is not able to release the child to the outer world. So all those things will also come under myometrium. So search out the devaluation, the lack of responsibility, the fear of responsibility, which is, so these are the actin and myosin muscle fibers. So they are responsible for the childbirth. So myometrial fibroids, as we talked about, it is about the connective tissue of the body. The muscle fibers, they are strong enough to support, and it is not nutrition. Please keep into mind that myometrium is not nutrition but support. So here is that I cannot protect my child. I cannot give strength more. So what I told is, the mother during that female was given that thing before, in the ancient times, not ancient, 20 years back, कि you have that capacity to grow as a mother. Now the thing is कि you are incapable enough, you are too timid, too shy, too weak to carry this burden, right? So pregnancy becomes a burden. I cannot protect my child. I don't have that strength. I don't have that stamina. I'm too weak. I'm incapable. I'm talking about incapabilities. So I need to proliferate. I have failed in my duty and responsibility. So I told you, fear of responsibility, fear of taking responsibility of a child, fear of growing up, because myometrium. So myometrial fibroid will again get divided into something just to the surface of the muscle tissue and something like deep down the muscle tissue. So when the mother is talking about the support, the strength, I don't have that strength, I don't have that stamina, I don't have that energy to give this child, to give anything to the child. So she takes up that I'm not able to support the children. The mother's strength in the world is just I cannot take that burden of responsibility of my children to my shoulders. Before, it used to be a strong lady. She was always prepared to get a child. And here, I don't want to. But definitely, there is a pressure from the family. You should have a child. Why don't you have a child? So all those goes into the crisis that they develop the intramural fibroids. So there is a lot of devaluation. There is a lot of insult. So see here, insults are there is devaluation. There is lack of support to the children, right? So there may be scarcity in the family, poverty in the family, there may be lack of nourishment. Even the husband has left them, or husband is not staying with them, or he has died ahead. So I have to take the whole burden on my shoulders all alone. So therefore, I need to proliferate so that I can cater the responsibilities and I can protect my children, right? I can give them that strength. Ki, don't worry, I am there with you. So all those conflicts will give you intramural fiber. Now we are talking to the another section of the uterus. We talked about endometrium, then myometrium, then the serosal layer. That is the outermost layer. That is the perimetrium, right? It has got most part is serosa, and this is squamous epithelium underlaid by loose connective tissue. It is just like the bag which is carrying the whole uterus. And the important is to just keep it aligned with other tissues and the organs which are outside the uterine wall. So definitely serosa is to separate it. First is separated from the other tissues and the organ. It's like the peritoneal cavity. There are other organs and tissues which are around. So I just need to separate it out, and then definitely there is lot of lubrication, friction which is happening around. So it helps prevent the uterus from those friction. So when we talk about serosa, serous layer is secrete a lubricating fluid which reduce friction. So we talked about subserosal fibroids also, and submucosal also. So submucosal also there was fluid, and serosa also there is lubrication and friction. So here also subserosal. The most important thing is when you talked about the subserosal fibroid, it is the outermost layer. So when you talk about endometrium, see, endometrium has got a certain capacity that it can grow in the uterine cavity. So the uterine cavity is like that. So they just drop down. So they are more like in the form of polyps. Myometrium have got the capacity little bit space in between the muscle tissue. So endometrium fibroids, they bleed. Myometrium fibroids, they bleed a lot and they are more painful. Menses, a prolonged cycle of menses is more into myometrial fibroids. But serosal fibroid, as we know, the serosal layer is not getting involved into any of the process of nutrition, or neither it is structurally that firm and that solid or a muscular layer giving support to the uterus. So it is the outermost covering, right? So serosa is outside. But the most important thing is this serosal layer is exposed to the outer world. It's into the pelvic peritoneal cavity, right? So it has got the huge place of the whole abdomen to grow. So usually the serosal fibroids are asymptomatic, definitely, because it has nothing to do with the menstruation or to the nutrition or something like that. So they have a capacity, they are very silent sitting in the zone, but they grow, and even to 5 kg of serosal fibroids can be seen and identified in the patients, right? So again, it is protecting from the outside world, that is the peritoneal cavity, the pelvic cavity, the organs. So they sense that there is a danger. It is the outermost covering which is protecting from the world. Before anything enters into the uterus, it is hitting it to the serosal layer. So defending children from the outsiders, I feel that someone is really hurting my child. I have that constant threat that someone will kidnap my child. I don't know. I have that fear that someone will poison my child. I don't trust anyone, doctor. I don't trust that anyone can give anything to my children anytime. I never allow them eat outside food. I never allow them go to any strangers. I never allow even my mother-in-law to give any food to them. I see to it, I feed them by myself. I see to it, they don't even have a chocolate without my notice. So that fear, that insecurity, that my child will be injured, the child is in danger, that sense of danger that motherhood has, and that will give you real fortification. That injury of fear of injury, that will give that fortification, and a serosal fibroid grows. And you know that serosal fibroid also is when the uterus is trying to look outside, not inside the womb. It's like outside, the antennas of the mother is like just facing the outside world, and therefore the mother cannot trust anyone. So it comes to the trust. This trust is not only the outsiders, but even the husband. I don't trust my husband. So there is danger from the outer world. So danger from the outer world, and I can do anything to protect my child, right? So now subserosal fibroids, again, when we are talking about, so they develop when the mother wants to protect the child from the outside world. Thus, these days, mothers have become so protective, so overprotective. Have you seen? They don't even allow the child to walk on the floors, right? They just put some protectors that the child will get injured. They get so obsessed with that thought that my child should be overprotected. They ask you ki, which food is good. They every time they keep on asking you what should be given to the child, what should not be given to the child. Is it good? Is it not good? Starting from the food to everything. And they keep the child with a nanny, right? Who is outside the world, and constantly, as a working lady, she is sitting in the office, she has that responsibility of the office, financial responsibility, and constantly there is an eye at home, what the nanny is doing, constantly watching the camera, that my child is protected or not, that stress that I have to. I'll show you a video, I'll share it in the group. I just forgot if I can download over here. There was a very beautiful video being released right now, where the mother, it was being a motherhood being enjoyed, where the child mother was constantly under stress that my mother, I have left the child at home and I could not breastfeed my child. So that talks about nourishment, right? But there are also videos where the children are in the threat, because the mother feels that sense that they are something fishy which is going on and the health will be ruined. So fear of diseases in the children, fear, anxiety about her near and dear ones, cares and worries full of, right? Fear of misfortune can happen to my child, right? Fear of some danger, fear of disease. So lot of anxieties will come over here. But when it is not me, it is not my capacity. See what happened in intramural and myometrial fibroids, ki I am incapable. Here the child mother knows ki I have the capacity, but I don't feel the outer world to be safe enough. So they just want to protect that uterus and just hug them tightly. So subserosal fibroids can go very huge to the size, right? And they don't bleed because it is not related to their self-devaluation. Are you getting the difference now? Where self-devaluation is affecting at the disease level? When you talk about self-devaluation, it is muscle, connective tissue, so intramural fibroids will come up. When you're talking about subserosal fibroids, it is the outside world and it's different. Now cervix. Now when you talk about cervix, as we know, it's an organ which is involved in the process of copulation. It is the gateway allowing the sperm to enter the uterus, and where the fertilization, the process of fertilization starts. So it is the cervix gives lot of cervical fluids responsible for intercourse process, right? So cervical fibroids are usually the fibroids when it comes to, when you're talking about cervix, automatically it is not nourishment, right? It came out to be a partner, involved into a partner. To cervix is somewhere involved into partnership, right? So the conflicts with the husband, the conflicts that my husband is not loyal to me, the problems with the husband, So related to sexual partner, related to husband, he's not loyal, he's not faithful, is cheating upon me. There is disappointment of love, there is deception from the husband, insecurity. The husband might cheat me. There are multiple partners with the husband. If a person comes to you with cervical erosions, right? These are very common. Cervical ulcers, the pathologies of the cervix, right? So please search the problem with the husband. As I have said, the miasms will change the cause also. So if it is ulceration or a bleeding ulcer which is there at the cervix, so please, there has to be lot of anger, aggression, frustration against the sexual partner. It can never happen without a sexual partner conflict. Might not reveal or unrevealed, but she cannot trust the person, right? She feels being cheated. I have seen a case where she came up that I have that incapability because my husband is. See, there was nothing which was coming up. Ki, is your husband cheating you? Is your husband troubling you? There was nothing. But gradually, over a period of time, we came to know that she is not being satisfied with the husband because the husband doesn't play the role of a male and she has to play the role of a male while in the process, right? So she was like, it is really frustrating for me. I have to teach him how to satisfy me. I have to go over him to help me out, right? So that is what at the cervical canal comes up, cervix come up. So that is all revolving about your sexuality and the relationship crisis with your partner. So it might be an extramarital affair, it can be a disappointment, it can be something seeking out like insecurity, right? And ulceration is anger, hatred, aversion, and definitely I don't want to see my husband. I just don't want his touch. I don't want to have any relationship with him. I had a case where it was classified, being told by the lady now we have decided because of the children we are staying in the same home or we are into the relationship continuing, but I don't trust you, so you go into your way, I will follow my way. So she has got cervical polyps which has developed because like she has left her husband. You go, you want to have affair with multiple partners, you have, right? She has another lady who is just having that craving that husband should come close to me, should be my partner, should love me, should affect me, should care for me. But the husband doesn't give a heck to the lady. So delusion of being neglected also will come up over here by the husband, especially. The feeling of being forsaken, left alone, abandonment. My husband doesn't even look at me. I'm so beautifully dressed. We are the richest people, but he doesn't even share a bed with me. I crave for him. And that craving day by day, when I come to know he's not sharing a bed with me, but he's sleeping with other ladies, gives me so much of frustration and anger that I just want to sometimes kill myself. And the lady has gone into that depression phase, that and she cannot come out because she loves her husband. The craving is that I want him, right? So she has developed cervical polyps with cervical fibroids and multiple cervical erosions now which has come up. She went for cauterization and all those therapies, but nothing has been helping her because she sees her husband every day in front of her eyes and no relation between them, but he goes outside. So that extramarital conflicts and all this will give you cervical pathology. So location of the fibroid also will guide you to the emotional pathology. As we all know, left side and right side. So when you talk about the left side, all the conflicts are related to the child. When you talk about child, pet, even I have seen fibroids when the mothers or the girls, they have got a motherly feeling for the pets. I had a case where the pet dog had to go for euthanasia and that was really a painful phase. I was very initial into my practice, so I could not understand so many things. But now, when I can connect the threads, I could see that I was very surprised ki why this girl who is not married will go into uterine fibroid conflicts. So she went into uterine conflicts because the pet had to go euthanasia, and since her birth, the pet dog was into their home, and he was so affectionate towards her that she used to pet him like her own child. She used to take care of the pet like her own child. So when you see those pet also, so those conflicts will also give you a womb conflict where you have that feeling of motherly and motherhood. So when it comes to the right side, definitely it's the husband, work, children, and left side, it is children or nest. I failed in my duty. Fundal fibroids is something over the head, like it's the head of the uterus, right? So it is from the superiority, the superior people in your family. Posterior wall is your son who will take ahead your legacy. Anything on the posterior wall, please think of the son, because son are responsible to take the hierarchy ahead. They are responsible to take you, they push you from the back. Just take it that way. So anything which happens on the dorsal part of your body, that is what the dorsal part of your body. So please try and search out where the sun comes up. And when it comes to the anterior wall of the uterus, it is more of the daughter complex. So this is what we have done. And anything related to here, we'll go ahead with the cases. Then I have presented with 2 to 3 cases if I have summarized. Any complications or any problems till now, so that we can go ahead with case taking part. If any queries and doubts, please put it in the chat box. So when you talk about psychosis, sir has, see, it's mathematics, right? When you talk about psychosis, it's mathematics. So when you apply, if it is a slow moving psychosis, the principle, the calculation is very clear, that identify the miasm, journey of the disease, cause if recent, if relevant, then only take. Otherwise, because it's a full-blown disease, please avoid going with the elements from over here. Find rubrics of miasm and general disposition, and thermal thrust combined, and peculiar generals and physicals. So basically, when it is a slow moving psychotic diseases, anyway, that time you please understand ki when it is a slow moving psychosis, because the cause, what Hahnemann sir has guided in aphorisms, that the beginning of acute diseases is perceptible, but the imperceptible beginnings of the chronic disease, right? If you have heard these words in organon of medicine, so these are imperceptible beginnings. They don't let you find and identify the cause, because even they are so long causes that even the patient is not aware. And as we have seen in the previous slides, that psychotic diseases are because of the slow lingering causes which are continuously ongoing, so since many years. So they become so used to it that they cannot identify the starting point of the disease. So therefore, in psychotic cases, please avoid taking ailments from. But when it comes to psychosyphilitic cases, where the syphilis has entered, so please keep into mind that if syphilis comes into play, don't miss the thread of syphilis. Identify that syphilitic thing which is going from psychosis to syphilis, right? So identify the miasm, journey of the disease, definitely what has happened in the recent, something which has provoked this psychotic pathology to land up into syphilitic pathology. So something has definitely happened, and that needs to be identified. If miasm is full blown, cause is irrelevant, then please leave the cause. Okay? Syphilitic rubrics at the mind or at the general disposition needs to be taken in hierarchy for prescription. Definitely combined with thermal and thirst and give a remedy. Definitely this psychosyphilitic will come back to Sora. So individualization now. As we have set up what are the things which we are going to present. So one of the thing was how the constitution affects the development of disease pathology. So this is the role of individualization, and understanding the constitution comes up. See, if a person, as I told you, there must be thousands of cases coming to you with fibroids. But why a person has only intramural fibroids? Can your pathology reports, can your sonography reports define this? कि why this lady has got only intramural fibroid, why this lady has got only serosal fibroid, or why this lady, she could have developed intramural also, she could have developed endometrial also. So how this constitution or the causative elements, how the life situation provokes the whole process, the journey of the disease. So that is what the body doesn't lie. We need to understand the disease pathology into its complete context. The body never lies. Don't leave that body ka part. If you have all the signs and symptoms, please try to understand location, sensation, modality, concomitant, each the totality, because that is the outward reflection. Aphorism number 7 talks about, aphorism number 9, they all talk about individualization, that how vital force is affected by the cause, and these imperceptible cause bring about the cellular changes, the pathology goes advances and the disease develops. So please don't try to just be a single prescriber, like कि ठीक है, it's uterine fibroid, give thalapsy, my work is done. It's uterine fibroid, give sabina. If it is uterine fibroid, don't give your favorite remedies because just it's a uterine fibroid. Try to identify the journey of disease. Try to understand कि soil has given birth to such types of diseases. So now I will present to you two cases. Both are cases of intramural fibroids, and both the cases, the situations are different. So how the miasms are guided by the individualization. Do you want me to go ahead or some other things, like, because the cases we need to be very concentrated upon the journey of the disease. This is a case of a 43-year-old female who had come to me. Recent case, not very long cases I'm sharing with you. My purpose today is not to show all this thing. My purpose is to show the journey, the individualization process, and how the remedy will differentiate, right? So she came to me that there are heavy menses, they are clotted, and there is a profuse leukorrhea. So please concentrate on the presenting totality. This lady could have presented with a uterine fibroid, which is not very big. It's just 2.2 by 9, 1.9 centimeter. And it is which wall? Anterior wall, intramural fibroid, right? So we have to put importance to everything. Again, if it is intramural fibroid, as we all know, there has to be devaluation, there has to be certain things like which has affected the value system, not able to support the children, not able to give protection to the children, not able to help them out. And since there is profuse leukorrhea also, so definitely she has not undergone the investigation. Is there any conflict because it is leukorrhea? Is there any conflict with the sexual partner? Needs to be identified. The menses are heavy. You know that uterus is also said when it is menstruation, it's bleeding, it's weeping for the child. So definitely, if a girl comes to you, if a lady comes to you with profuse and heavy menses and they are hugely clotted, right? So all these things needs to be considered in your totality and also while you are prescribing a remedy, right? So what happened in the journey of disease is, this is a female who had come to me that she has got a, see the gynec history, can you see? G10, para 4 and abortion 6. So how does this will also affect your history? So she has undergone 6 abortion. I was shocked that how can a lady at this era have the capacity to bear 10 children and to bear the loss of 6 children, where only 2 MTPs are done and rest are missed abortions. DNC has been done because it's a missed abortion. So, and she has 4 children. The children are not staying with her. 2 children are staying with a nanny house, and something is there in the history. So what importance I could see was that was which was clicking my mind. She has to be a lady who is so much fertile. A single abortion, what we have seen in the pathophysiology is कि a single abortion can give an injury to the uterus, right? So now from this structure or from the pathology, what I understand is that now I want to proliferate. Why? Because I have got recurrent losses. Somewhere have I been challenged for my fertility? No, I want to prove myself, right? that I can have children, right? Does she have a pressure of a female child? So all these questions, they start coming to my mind when once the body is shown to on the page. So what are the conflicts then? So just go ahead with the journey of the patient. So she was from a very poor family where they had almost 10 to 11 siblings in the family. Father had two marriages because her original mother had died because of burn injury. So father went for a second wife. Okay? So it's a family where father was very rude, very strict, would not allow the family to go out, would not allow this girl to go out, even to stay without a dupatta on her head, or so many restrictions in the family. She had stepsisters, and she said, I was very moody to talk more at home, and outside I used to be introvert. She used to change herself. I am very moody. I could not communicate so well. She had stepsisters, and a mother. Stepsisters would torture the mother, and she said ki my father would always favor them. So she was not very clear ki this marriage, because she was too young, might be when the father got married. So she could not understand it was because of an extramarital affair or what. But she had that feeling that always these stepsisters and that stepmother would torture her and devalue her, and father would always favor. So there would always be a desire that I should just run away from the family, because I did not have that courage to fight with my sisters, and I was too timid to fight to them. And since I had no support in the family, so with whom should I fight? So I had that low confidence. I even in the studies I was not so good. Even in the curriculum I was not so good. I was okay, but sincere student in the school, and there were no complaints from the school. But father would always force me to do the household work, and I would always like, there used to be always a question, always so good and so kind person, but that I always get trapped into such situations, and I'm being blamed for the things which I have not done. So she would not understand even in the childhood ki why she was being beaten up, why she was being punished, and why things are not happening according to her wish. So that is lot of insecurities ki am I not good? That gives you devaluation. She would say ki I was always a person who could not retaliate back and fight back, and I would just sit in the corner and cry and just weep in the corner of the room and just express myself in when alone. Few friends I had, but I did not had that courage to share with them. And because I was into household work, while working outside, I used to go and take water, collect water, and everything. So that time someone selected me, and I was being married to that boy without any inquiries. So at the early age of 18 years, my father got me married to the person. But unfortunately, the in-laws were not good. They used to keep me at their own place. They were staying away from the native place, and I was supposed to stay separately from the husband. They would not even give me food. They would just torture me and would not allow me even to sleep. They would just ask me to work day in, day out. I had to communicate. I was very helpless. I had to communicate to my husband, but he never supported me. And I was kept separated from him for a very long time. And then, even afterwards, I was out, not with husband, still I was being blamed not to have a child. And then later on, I came to know that my husband has got an extramarital affair, and there are frequent quarrels which used to happen. So father was very strict, and because husband was not there, so there was definitely, how could I conceive? But for that also I was being tortured, I was being blamed. So see here how the history is evolving, how the life situation is there. What we have seen previously was the devaluation conflict. What the body says that there is an intramural fibroid. So intramural fibroid talks about support, talks about insult, talks about devaluation which is happening for the things which she has not done. So can we take here rubrics like delusion, wrong suffer she is, delusion that she is being forsaken, she is a person who is helpless, crying, weeping, right? So such things are getting evolved. But the journey of that patient says that the person is very timid, low confidence, and because of which the husband, as we saw, that husband had an extramarital affair, because of which the husband left her also. So she was left with two to three children at that time. Her brother and sister-in-law at native place, they supported her to bring up the children. But what happened was, when the husband tried to come back also, to whatever plots they had, whatever property they had to sell out that property. Now she was left with nothing. So already she had been suffering with so much. Now she was left with nothing. So already she had been suffering with so much of poor conditions since childhood, and now also the husband has come up, who has cheated her, who has been hitting her, blaming her, and so much of deceived her, right? And still this lady has not retaliated back. She says, now my husband is good, and he doesn't say anything. Now he even if he doesn't care for me, but he doesn't torture me. So I'm okay with it. So it tells about that this lady had been so coward and submissive in her life that she could not retaliate for the injustice which has done. So whatever happened, she has got a single attitude, is she just hits herself and she keeps on blaming herself for everything. And she says ki, even now, after so many years of my marriage, I remember my past and I keep on crying, doctor, I cannot control my weeping also. I'm so anxious, I'm worried for that I don't have a rented house where I can keep my children protected in this house. My husband too doesn't support me a lot, right? So I have to alone take care of my children. But even I'm not educated enough, I don't have that courage enough to bring my children so well. So that anxiety had been mounted me from my first child. And these, I asked her, ki, what about the recurrent abortions which you had? How did you survive with those recurrent abortions? She said ki, when I was being blamed that I don't have child, to mere man mein hamesha raha ki, no, because in our religion, satisfying the husband is the biggest thing which we have to do. So I never had, I asked her, ki your husband cheated you, the in-laws tortured you. You didn't have hatred for the husband? She said, no, never. In fact, I used to feel that if I give children, he will come back to me. If I, and she had that affection towards the husband and attachment towards the husband. And therefore, I never blamed my femininity also. I always had that desire to have children in my life, and I would love having kids. Even अगर हमारे इसमें तो ऐसा है कि we never abort, so even if I used to get pregnant, that is okay for me. So she never retaliated back. So now from the history, you can see that incapability in herself, that incapacity, that cowardice, the resentment that I have to prove myself of femininity, that has giving an intense pressure. This case was not being flashy to me or fancifully solved, but there are so many rubrics which come to my mind. But simply, I will share you the totality on which I had prescribed, because this was a slow moving psychotic case. The syphilis had not entered, like only the thing was syphilitic was recurrent abortions which were there, right? Those recurrent abortions, but that recurrent abortion has not affected the fertility part. So you cannot take ailments from abortion, right? So definitely we want a lady, a constitution, who had been so submissive for the father, firstly, then to the husband. She has always been a lady who has given up in life and never tried to fight back to the situations, letting go whatever has happened to her way. And she would always be, and the reaction of herself is blaming herself and weeping for all throughout the life. Can anyone guess the remedy? It was a very simple case. I just wanted to show you how the constitution plays an important role. So here we analyze the case that she wanted to protect the children. She's fertility is so good. That was very remarking for me. After having 6 abortions, still she's fertile. So I took it in the analysis that yes, fertility is good. She's timid, submissive, weeping, anxious, helpless, neglected, rejected, anger suppressed, brooding. The most common remedy which comes to your mind, please put it in the chat box. Let's enjoy the session. Yes, the remedy is nothing but the rubrics which will come up is first rubric was anxiety future about, cares worries full of, confidence want of, weeping at ruffles. The remedy is pulsatilla. So all claps goes to the dynamic group which is taking participation. So this is definitely a picture of pulsatilla. And when she had come to us, the sonography is normal. So this is a very simple case, but what I wanted to say to you is how pathology takes the soil and how the constitution plays an important role in evolution of the disease. So this lady gave rise to intramural fibroids because she wanted to give more space to the children. She had that high fertility, and one of the most fertile remedies of materia medica is also pulsatile. So that has to be taken into consideration. The constitution which has given rise to intramural fibroids, there is a single intramural fibroid, not so painful, not so problematic, which has gone even now with the remedy. She had hyperacidity. Other complaints are just hyperacidity, which is better. She feels very delighted now. The BPful mood has gone. She had constipation also before, which has settled with pulsatilla, and no further repetitions have been given by pulsatilla. Now I will take to you, this is a case of success story. Now, because we are students of predictive homeopathy, we need to be very loyal. The potency was 200 single dose which was given. Now, being loyal to you people and from the desk, I would like to share one of my failures. So this is a case which I feel this is a failure because I failed to understand the process of the disease. And when we were discussing this case, I realized I have made blunders. So I try to present my failures also on this platform. So this is a case of a 43-year. See, that was also a 43-year female from the same community. And this is also 43-year female from the same community. Now, please see the constitutional. See, my aim is not to present the remedy or the process, but I want to tell you how constitutions give psychosis and how psychosyphilis comes up and how mistakes we commit when we are dealing with these cases. So this is a case. She had come to me when she had recent case of abortion, and there is profuse bleeding which was not even controlled with hormonal treatment till the level of that she bleeded that her hemoglobin is 5.5. And to tell you to the surprise that I don't know why this went unnoticed because she did not go to the doctor. She was not even aware that she's so anemic and she looked so pale. She was very fair complexion and complete white mucosa because of hemoglobin which was 5.5. So uterine fibroids. See here, you will see that anterior wall fibroid, the size is so huge, 8.5 by 6.3 centimeters. It's huge, right? And the posterior wall fibroid, it is also an intramural fibroid, which is 3.1 and 1.8 centimeter. So size of the fibroid, location of the fibroid needs to be connected. She also had 4 abortions, including this abortion, which was recently there. She said, my children are so grown up now. In front of them, how can I have a child? How can I conceive? So this was an unplanned thing. So I had to go for abortion doctor. How could I bring my child? And she's also a family from the family of 10 siblings, right? In her family. So it's okay if I had this child before, bhi hote to chalta. But right now, at this age, no, I don't want to have those complications of those pregnancies. And I'm really very anxious that I should not suffer from a disease because till now, the first word what she said is ki I have not allowed a male to touch me apart from my husband. So if I get disease, some other doctor might have to examine me, which I don't want. So I've come to you because you're a female doctor and I don't want any complications to happen in my life, right? What she said is ki I belong to a not a very poor, but a mediocre family where we had 10 children and my father was the only earning member. But still, my father was too caring for us and was very kind-hearted person. And he was strict, but things were good. So he wanted that we should be well behaved and we should be good to everyone. So as such, I have got good memories of my childhood. And I never felt ki there is a problem in the childhood. I could adjust with whatever it was. And as you all know, ki my mother who died with very early age. So I don't have the memories of my mother. So what I remember is ki my father always wanted to behave well, and we had to take up the responsibility of the family very early. And because of which that life situation, even I was married at very early age of 16 years. समझता ही क्या था जब चार, तो she said कि I was not educated person, so I was a person who used to be calm and quiet, and there were so family disputes, so everything was like I was a person who used to talk less in the family and was not much educated. So I felt that I don't know how to talk to people. So even after marriage, I used to keep quiet. I was the person who used to listen more. I had so many of co-sisters in the family. My mother-in-law, she was the hell. She was so rude, so strict, and she used to always pass comments upon me. And I was the person who had to tolerate everything because I could not retaliate. And my father would always say, you have to behave good and you have to tolerate. Being a female, you have to justify everything and tolerate everything. So being a female, I felt ki this is what my life is and I have to serve like this, and therefore I could never retaliate. I was the only person in the family who didn't know how to study. So I used to always feel ki my mother-in-law is comparing, or even I used to compare myself with my co-sisters, and I said ki it's okay. And the problem was that my husband had got so many sisters. So he was already under that burden of sister. So he always gave me a pressure of having a male child. He would always say. So that pressure was always mounted upon me. And whenever I had those pregnancies, I used to get very anxious that it should be a male child only. Unfortunately, I have got male children in my family. Now my husband says कि अरे यार तू कितना अकेले परेशान हो. So that daughter वाला part was constantly into her head, and every time she talks about that कि अरे मेरे को घर में बहुत सारा काम है. I have lot of work in my family to do at home. I am alone. I'm not feeling well. I'm bleeding so much. I have to do everything at my home. मेरे बच्चों को खाना कौन खिलाएगा if I'm not serving them, if I'm not cooking well, because there is no one in the home. So feels that no one is there to support, and if she is not cooking, then who will do it? So all the household responsibilities are upon her, and she has been bearing this responsibility from such an early childhood. So husband is like, okay, there is only one thing is about the male child, what he used to pressurize during pregnancy, and the second thing is dominating. But I have accepted him what he is, right? Only thing is, I just don't want a male to touch me, and I don't want to spoil my religiousness. Whatever come maybe. I asked her, you are bleeding to death, do you realize? Because when she had come to me, it was just 15 days back of abortion, and when she was brought to me, she was bleeding 10 pads a day. That she has bleeded so much. But she was like, whatever it is, I don't want to go for surgery. I have real that fear of surgery, and I don't expect much. You just cure me. So this is the case. Can you put up totality for this case? I'll show where blunders I've done. So she says ki I have children, they all are males. So there is financial issues at home. We are still in the rented place. It's a very small house. I'm very conscious when my husband comes near to me. All the kids are now grown up. How will I have? So all these talks she had. So we analyze this case that she is a lady who is too rigid with her feelings. She's responsible and she has taken up the responsibility in early childhood. Definitely anxious for the future. Female child, no house help. So she feels lonely. She feels that I am incapable of taking up all the responsibilities so early. And I feel I am low confident and I cannot face the world. Right? So this is there. Now tell me, have you understood this was the case? And as a doctor, I was very hurried to prescribe, and I saw only that timidity, and I saw only, I'll tell you all the journeys. I just saw all those things in the case, And I was very hurried to prescribe because even I got anxious that she's bleeding so much. Oh my God, how will I handle this? And I didn't give so much importance to what she was presenting. And I landed up into prescribing a remedy, which is shy, confident, timid. And I didn't give importance to this previous abortion. And just I gave her calcareum mu 200, right? This was my first blunder, which I did in this case. So what happened is after giving calcarea mule, because I tried that she's introvert, she's timid, she's like a calcarea look wise also. So let's land up giving her calcarea mule. So an introvert muraticum, right? With combined with calcarea. And since there is so much of rigidity, she's not retaliating back. She's too timid to fight back. And she's low confident. She's so conscious for herself. So definitely a calcarea came up to the mind. And I prescribed. What happened for my dismay was the flow increased more, right? So again, when you're treating uterine fibroids, if menstrual bleeding is normal, increased, matlab she had scanty menses, now the periods are normal, that is okay. But if she is into menometrorrhagia and the menorrhagia wala part, the bleeding increases, remedy is wrong. So reevaluate the case. I tried giving her CPR. Even I landed up giving her all those medicines like Sabina also because I already committed a mistake. So a lie gives rise to a lie. So again, a mistake gave rise to another mistake. And then finally, I was fed up because she was bleeding so much. I gave her lachesis just to get, because it was a profuse bleeding, it was clotted, and she had so much of weakness. There was flickering in the eyes because of the weakness. She said ki now I'm not able to tolerate because it has been a prolonged time that I'm bleeding and now I'm really very scared. But after giving lachesis, the what happened is the bleeding subsided, right? So what happened over here, he committed a mistake was I did not give importance to miasm. The miasm here was not psychotic. It was not a case simple coming to my desk with a fibroid. It was a huge intramural fibroid with an abortion, which was very recent. So what psychosyphilitic was, this bleeding was not soric or psychotic. This bleeding was syphilitic. So I had to consider a remedy which has to be a bleeder, which I forgot while thinking about calcareum mu when I prescribed. I just didn't give importance to that. That was my blunder. Then definitely I had to give importance because she had bleeded too much that she has become anemic. She could have landed up into syncope. All the complications of anemia could have happened at this 43 years. And she's a person who has so much of fear and low confidence. So the remedy has to be, I give her lachesis. Is it a right remedy? Time will decide, right? So I gave her lachesis, the bleeding stopped. I was like, relax. This is what happens, right? Sometimes the pressure is so much mounted upon you by the patients that you just want to somehow give a prescription, and you know that you have already in such cases, what sir used to say is that when syphilis is really very fast, a psychotic remedy which is very close to the simillimum will really spoil the case. And this happened with this patient also, that my wrong remedy has really misguided me and has passed in that process of syphilis. Lachesis could help her. But again, lachesis could help her for a month, for 2 months. Again, the flow started and that was heavy. Okay. At that time again an incident happened that her sister had to go hysterectomy. So she was like, yeah, I don't want to lose my uterus. Doctor, whatever you want to do, you do. So what again I did was I again prescribed lachesis 200. Then I underwent a USG after 3 months. So that anterior wall fibroid, which was into 8 centimeters, had slightly reduced to 7 to 5 centimeters, and the posterior wall fibroids have also reduced in size. So I was like satisfied, now things are going well. But again, the bleeding has yet not been solved. So how will you assess this case? Are we in right direction or we are in wrong direction? So definitely I thought that somewhere we are not in the right direction. So I gave her CP also. I gave her Now also I'm landing up into wrong decisions only with this patient because these patients have not got cured till now. So this is what I wanted to present to you. Ki I am waiting because now the right remedy. I even prescribed a Sabina, telling you because the typical character she had of clots and that bleeding because of uterine fibroids. I took tumor uterus and there even Sabina was very coming up, and the clotted menses she had in the menopausal age. But what I was missing here is I have to consider this abortion. So you can take things have started from abortion, reevaluate the totality. Yes, I gave her this sycosis, right? Thinking of a snake remedy, right? Which has temporarily altered the bleeding, and definitely things are gradually reducing. But what I was falling into pit is I was frequently needing lachesis doses. If the remedy is right, the need of remedy should not be so high. And first, the syphilis should start settling. The hemoglobin did not get settled. She was still pale. I had to put her on some oral supplements of iron supplements because otherwise the patient would have fainted because she was bleeding so continuously and there was a constant pressure from the family to go for hysterectomy. So, yes, when a syphilis enters, so you should take a syphilitic rubric. So, rules for prescription in such cases will be when it is a psychosyphilitic pathology, search a syphilitic rubric. The phase of the phase similum or the phenotypic prescription should be given. First, try to stop the syphilis which is going ahead. So, the bleeding, which is bleeding to death, that should be stopped with your remedy. So that is what should happen. If the size of, see, if you will say you are very happy because size of fibroid has reduced, but still if she's bleeding so much, she gets panic, she gets giddy due to the bleeding, that means your remedy is not right because the size can vary, it can be a mechanical error. And then when I properly saw the reports back again, I saw that the posterior wall fibroid, which was only one, now there are two posterior wall fibroids which are visible. Only the anterior wall is reduced by 1 centimeter. Again, a wrong direction. Again, I'll tell you, it's a wrong remedy, it's a wrong direction. Again, reworking the case is required. We need to consider a bleeder. We need to consider a remedy which will affect the abortion process, because everything has started from that abortion. But what was more important in this case was that embarrassment which she had faced, which was very syphilitic, right? That fear of being faced to the world at that 43 years of age. So that cause in the mind was really syphilitic. And I will not say that she's fanatic, but that rigidity in her, that I don't want to be touched by the males. It is not because I have aversion to male. I allow my husband to touch me. I enjoy that process. But the problem is that I don't want others because that is a part of religion. This is what, so again, I reviewed the totality. And when we review the totality, I think we should give importance to abortion and abortion history of. So we can think of abortion, just see what rubrics we have from abortion, because this has gone miscarriage, months, week, thirds. There is no recurrent abortion right now. But yes, the symptoms have started from abortion. Yes, we can take that abortion into our consideration. And anemia, which has come up, yes, she has bled with the death until the death, miscarriage, prolapse, restlessness, sequelae of abortion. Can we take this rubric? Sequel of abortion, because that abortion has created everything in the list. Let's just take this rubric. I'm working this case along with you, right? I've not worked it, I've not decided the remedy, but I want the whole group to go to that process and churn your brains and see, can we take tendency? No, this is not tendency of abortion. In the previous case, yes, it was tendency of abortion because there were 6 abortions, right? Can you say that this abortion is ailments from? Yes, we can think of ailments from women in flabby, hystery, crowny, yawning. No. Induration, uterus, abortions after. Inflammation, uterus, abortion after. Yes, we can think of because she's bleeding. So this is where I gave Sabina. I don't know why I didn't wait, because that was my anxiety. I'll tell you. I gave Sabina, but I didn't waited for that Sabina to act. I don't know. Matlab, this happens, right? This is what there is menorrhagia after abortion. Yes, we can take this pathological rubric of abortion. So this is what I wanted you to show live. And the third thing, which was, if you take that this is aversion to male, you will land up into another fault, because this is not aversion to male. Rather than it is like she doesn't want to get herself hurted by her fanatism. I will say that this is her rigidity, that is her obstinacy at the level that she does not want to bend. This is, don't you think this is audacity? Even if I bleed to death, it is okay, but I don't want to get surgery done because I don't want another fellow to touch me. Is it not a part of fanaticism? Yes, can be taken as religious affections, fanatics, as a rubric for this case. And third rubric, which I will take as a syphilitic rubric, is definitely an embarrassment, which is there in her case, because everything had started from that embarrassment, which I'll face in general. So embarrassment, general, mental symptoms from. So yes, this can be, and definitely a death rubric can be combined here if it is. So the remedies which are coming up are platina and sulfur, kalika, sabina. So what is the remedies now? If I'm working to you, the remedy sulfur is a strong hatred for going for surgery also and going for allopathic medicines also. She has that in her mind inbuilt ki I don't want any male to touch me and I don't want to take allopathy. So these are the rubrics which I will consider, because I have to consider the syphilitic pathology over here, and I have missed the miscarriage ka sequelae. So what are the rubrics when you consider metrorrhagia, abortion after platina, kalika, sabina, sickle cord, thalassemia? Again, they are the specific remedies for uterine fibroids. So if we combine it, only go for specific remedy, we will again land up into a complication. If you'll ask me, ki there is no metrorrhagia in sulfur after abortion, but definitely sulfur covers the sequelae. So there we are trying to treat the anemia also, which has come after the abortion. So this is what the way of analysis of the case and reworking the case comes up when you talk about all these cases where the syphilis is land up. So the difference between the two totalities, the two constitutions, that this fellow, this female was affected because of the abortion, because she felt embarrassed, she was hurted, and she was really not feeling good that she had to face everything at this age. So this is what abortion, again coming back to our totality, right? So this is what I wanted to tell you all, ki how psychosyphilitic pathology, when you are considering, what you have to do is consider all these psychosyphilitic pathologies, select for the syphilitic rubric, because you have to just bring into grip. So abortions equally of metrorrhagia, this is all syphilitic because this is a syphilitic presentation. Now you can think about a remedy which should be combined with a remedy. Yes, you can think of a remedy like sulfur iodide. You can think about a deep acting remedy. Even you can think about a fanatic remedy, which is definitely very deep acting. They are so fanatic people that they are not even considering what will happen. So rubrics, so this was the case. कालिका is ruled out because कालिका के अंदर जो anger होना चाहिए वो anger is not visible in her. She is not that haughty like Platina, and she is not like Sabina also, because Sabina is somewhere submissive also. Sickle cord is too syphilitic, scrawny, thin, very syphilitic, offensive discharges which are not there in the patient. Stramonium, definitely not covering the totality. There is no panic attacks even from the childhood. She's just giving up all through her life, not like China. And yes, we can think of semicipiga in this case when we consider, we have to reconsider the totality. Now, what is the next step? So I had done a blunder in this case, repeated so many doses of Slackesses, still not given relief. Only thing was satisfied was he Patient says you are giving homeopathy, I'm happy. Now a right remedy will go. After the syphilis subsides down, I will have to review the totality and again consider a remedy which is in relationship to syphilitic remedy, but a GCS2. Fine. So the tools are very clear. This is what we need to do. And therefore, I try to practically perform in front of you how we repertorize such cases. So these are few rubrics specific for the fibroid, which you can think of. So many things we have discussed. Just to summarize all the rubrics of fibroid: ailments from anger suppressed, ailments from suppressed grief, from mortification, humiliation, insults, disappointment of love, from deception, cares worries full of, care worries for the family, dwells on past disagreeable occurrences, the old stories, they affect profoundly. These are the rubrics. Brooding, lot of brooding, right? The memories of the past, they affect profoundly. There is a rubric that they cannot come out of those thoughts and they are just dwelling on the past disagreeable occurrences. What happened with pulsatilla patient? She would just sit in one corner and would cry involuntarily, thinking of the past occurrences. Cares domestic affairs about, because yes, it is the womb conflict. So family affairs, domestic affairs, children, anxiety, cares and worries, family, coward people. They are the people who don't know how to find a way. Somewhere they are very timid, they are coward. Therefore, they just suppress their emotions and they cannot express their true emotions to the world. So delusion, she's alone in the world. Forsaken feeling, delusion of being left alone, delusion neglected, pursued, home away from. This is also very important rubric which we can consider away, because they feel that they are not in their home. When you feel it's a subserosal fibroid, because I told you serosal fibroid, they feel they are not being protected. So they have that delusion that in the home only they are not being protected. Delusion, strangers surrounded by, again a serosal fibroid, we talked about this rubric. Delusion of being persecuted, the whole family is just behind them. Delusion, wrong done she has. I had another case where she had developed a uterine fibroid which is calcified. Now, when we are talking about all these things, one more case came into my mind is when we are talking about Hering's law or approach to these cases, if it is a calcified fibroid, that fibroid will not go away, because the process of degeneration, calcification, and the pathology book says that after that there nothing can happen. Even calcification, if happens in the ischemic heart disease or in the walls, that is the last process of atherosclerosis which cannot be reverted back. Even our remedies cannot work. In that case, I was like, why this lady has got so early degeneration and calcification, and the fortification has reached the level of calcification. So in that case also, what happened was that the mother is so protective to the son. She has the only child in the family. She even did not allow the child to step up the sofa when he was 2-3 years. If the child is sick, the mother used to go so panicky that she would just sit in the bed like this, sitting in front of the child and just observing the child, and the fear that if I skip a breath, I will, something will happen to my child. So that fear that something wrong will happen, something misfortunate can happen. I just want, if what she says ki if it is possible for me, I will take this child back to my home. I just want to protect the child from each corner. She would not even allow the child to go and play outside. The child has become so timid and all, you won't believe, she won't even allow anyone to touch the child. She was so possessive for the children. And I will tell you, the fibroid she has developed is large anterior wall fibroid compressing endometrium. This is one. This was before, and again she had developed a fibroid later on, which we came to know that there is calcification and there is a lesion which is peripheral vascularity, favors fundal fibroid with calcification. Posterior wall fibroid, which is 2.9 by 2.09 centimeter. The child suffered from epilepsy, unfortunately. So she was so overprotective towards the child that she could not leave the child alone. Even in the night, she preferred to leave her husband, but not her child. So there is clinging also which can come up. and the as a pathological rubric also, because they just want to cling to the mother, to the child, and they don't want to move away. So fear disaster. What she had suffered was that something disaster will happen to my child. I don't want to leave that child alone. Fear of poverty, definitely. Giving insecurity, future crisis. Again, endometrial fibroids will come over here. When you talk about poverty, you talk about nourishment, you talk about nutrition. When you talk about starvation, again, it is endometrium. When you talk about indifference, it is endometrium. When you talk about positivity, it is intramural. So these way you will have so many rubrics which can come up. They are helpless people, obstinate, avarice. They don't want to spend money. They just want to keep it accumulated with them because they cannot spend. That is the psychosis part. They have prostration of mind. Sadness is there. So rubrics, now again when you talk about pathology, so rubrics of the pathology, you can take rubrics from tumors, fibroids, you can take the character of the bleeding. What we took was menorrhagia, abortion after, metrorrhagia, abortion after, tumors, fibroid, hard. There are so many rubrics which can be specific for the pathology, that is body. So mind and body correlation, just combine them. I could have taken in that totality. Tumors, uterus, definitely. Sulfur is also remedy. Sabina is a remedy. So any questions? Because this is, I think, a mother is more than just the first house you call home. She is the reason of your laughter, the calmness in your chaos, and most importantly, her love has no limits. So when you talk about a motherhood, you talk about protection, you talk about love, you talk about that lovely relationship she shares with the child. It's not just grooming the child in her womb, but also protecting the child once he's out of the womb, and that mother and child connection is throughout the life, never unbroken, never, they cannot go apart from anyone. So this is end of my session. So before we call it end of the day, let me take out the question answer sessions. I hope you all have enjoyed the process, and you have any queries, doubts. There were few chat box queries I would like to answer and address. So someone has asked me about the first doubt which was being asked was, one doubt is endometrial is nourishment, myometrium is support. So definitely intramural fibroid is also related to what we have seen is intramural fibroid is again, intramural fibroid is a part of myometrium. But these intramural fibroids are embedded deep below the myometrium. So these are again related to your evaluation conflict, that support of the children. Definitely, they are not able to protect the children. Fear of misfortune will also come over here. Fear will definitely, that I want, matlab, the motherhood is so strong that the mother even wants to fight with the god to protect the child. Can you imagine कि वो हर जगह लड़ सकती है? That is the power of motherhood. The next question was, anterior wall fibroid is related to the daughter conflict, posterior is to the son. That is what we saw in our case also, that the mother, that lady, the only stress she could say was that I always had the desire to have a female child, and the pressure she had was to deliver a male child. So definitely there is no support. If I had a female child, I would have got support in the family. So I wanted support from a family. That is why she had anterior wall fibroid. So she had anemia. If there is a question that if in a case there is a fibroid which increases in size but bleeding is better. See, up to certain extent, if the bleeding, again, if we go back to our case, what we saw, key size was better, but the number increased and the bleeding is still continuing. So definitely it is a wrong direction. But if it is a syphilitic bleeding, again, whenever you analyze a case, you want to see Herring's law, please give importance to the miasm. If the miasm is reverting back, bleeding is syphilitic, growth is psychotic, but it should not be beyond the limits. If she's bleeding up to death, yes, that should be stopped first. And if she goes into psychosis, slight increase in the size of the fibroid, still it is okay. But it should not be a tremendous or huge size that it should go to in kgs. That is also life threatening, right? So that should not happen. It should be optimum. Reversal of miasm is first in Hering's law. Therefore, syphilis to psychosis is okay for me. But if syphilis is increasing and psychosis is also increasing, what happened with my case, that is what I shared, is wrong. In abortion cases, if already going on, bleeding is increases after medicine, is it wrong or should we wait? Again, I will tell you, when you are talking about any rules of prescription and you know that you are dealing with abortion. What is it? Abortion is again a process where the child is being pushed out of the womb and the mother wants to get rid of the child. It can be a forceful, it can be unwanted also, it can be due to a DNC also. If it is a normal bleeding is normal after abortion because the endometrium is built up. But if that bleeding continues, even that second cycle has started and it's been like she's huge bleeding, definitely it is wrong. Sir would always say he a normal flow, like a lady comes to you with psychotic pathophysiology, and if you give a right remedy, her normal discharges, her normal flow increases. Usually it used to be 3 days a cycle, and in between it had stopped. Now after your remedy she had started again getting a normal menstrual cycle. It is the right direction. See, abortion is syphilis, giving pumping syphilis is again wrong, right? So psychosis is okay. See, I have presented according to my understanding of structure and function. I always take is what structure, what is the function of that structure at the cellular level or the tissue level, right? Hemorrhagic cyst is again a syphilitic pathology, because if you talk about hemorrhagic cyst, it is again something not good, because hemorrhage is inside the ovaries. Inside the ovary, having a chocolate cyst is a sign of endometriosis, right? Usually we see hemorrhagic cyst in endometriosis. Again, endometriosis will lead to infertility, so many complications. It is psycho disorder. A normal cyst, that is a follicular cyst which develops during the course of time, is okay, right? Is okay to answer. But a psychosyphilitic cyst, because where there is a bleeding, huge size of cyst, which can even lead to torsion of the ovaries, is not good. It can lead to infertility, it can lead to complications of ovaries, even it can lead to malignancy. So definitely it is not good. Hemorrhagic cyst, definitely it is psychosyphilitic. I have seen cyst hemorrhagic, again because we are talking about what is ovaries is identity crisis. So you have to take some identity rubrics when you talk about chocolate cyst or hemorrhagic cyst of endometriosis, where the femininity is also at stake. There is lot of possibilities that she wants to be pregnant, she's being humiliated, she's being insulted for being a female, she's being looked down upon by people. I have so many cases of endometriosis where they are being insulted, humiliated for what they look. They are being like, there is aversion what they see in the society. Then there is another question. Patient has prolapsed uterus, intramural fibroids, bleeds scanty, endocervical polyp, severe itching per vagina. Mind, husband keeps finding faults. So again, we will decipher this case. Like, there are 3 to 4 pathologies. First pathology is prolapsed uterus, intramural fibroid, and because of which there is an endocervical polyp also, again a kind of fibroid, and because there is itching severe. Now again, the whole process, if you will see and decipher, prolapse uterus, what does it talk about? Uterine prolapse is because the uterine muscles, the ligaments, the tough tissue which is supposed to carry the weight of the uterus in the pelvic cavity, the sepia has got the typical sensation that something is pulled down out of vagina, is because of that prolapse. So she is so timid that she cannot fight against the things, and therefore there is laxity. So prolapse uterus is not psychosis excess, but it is psychosis less. So again, elastin less. So what is the elastin mind? That is a very different topic. When I'll take some case like that, you can correlate ki she cannot fight against, she feels she's too timid and she cannot fight against, and therefore that lot of anger which is there, and she feels so helpless, she cannot she feels helpless in that situation, she cannot hold even her situation at that time. So therefore the uterus loses her himself and she has to fight for her children, right? That is a womb conflict. Now again, endocervical polyp is again a conflict with the husband. So as you can say, you have only said that the discharges of endocervical, because endocervical polyp has got a tendency to just prolapse out of from the cervical canal. If you will see cervix, I have taken cervix, right? So endocervical polyps, they just pop up from the cervical canal and they come out, because of which the cervical discharges are very acrid. And because of the acrid vaginal and cervical discharges, there is itching which is there per vagina. So there is so much of acridity, anger, hatred for the husband, but which she is not able to vocalize that anger, and therefore you have to take a remedy which has got lot of anger suppressed. And as we have seen, this is an insecurity about husband, therefore induration, insecurity, and can be ulceration also. So that is what in your case also you have already summarized, ki husband keeps faulting. So definitely the husband doesn't trust the wife, and the husband doesn't allow the wife to speak somewhere, right? So go again into the deep, find the sexual history about the lady, and you will find the remedy. Is it an aversion to husband, or she has so much problem that she has so much devaluation from the husband side? Now coming to adenomyosis. So what is adenomyosis is again, yeah, I'll take that picture. Adenomyosis is again into the intramural. We have to enter the intramural part and the myometrium part. So myometrium and the, yeah. So myometrium of the uterus, right? When it gets thickened, when myometrium gets thick, the wall gets thickened overall. The overall and the myometrial wall gets thickened. That is called as adenomyosis, which is also called as a bulky uterus. A very common finding in menopausal age group. Definitely, it is not a good thing. If she bleeds, she will have lot of hemorrhagic menometrorrhagia as a complication. Here again, why the muscles are getting thick when we are talking about adenomyosis, again the pathology says ki myometrium is getting thickened. The child, she wants to protect her children, she wants to give them more nourishment, she feels that she is not capable enough to sufficiently support them, and therefore lot of support she needs. So again the pathophysiology of adenomyosis will be very close to myometrium, but this will get combined with inefficiency and devaluation, but that is being very prolonged, right? Patient is having multiple fibroids in different layers. How to probe? So again, if it is multiple fibroids, so many, see, psychotic diseases or chronic diseases, as you all know, it never comes with a single plate or single supper. There are so many things which get combined over a period of time, and therefore there will be multiple conflicts which are coming up. One is popping up, there can be multiple reasons. I am inefficient, I want to give nourishment, the situation is different. Like in this case also, we had both type of fibroids. We have intramural also, endometrial also, and definitely the case which had been endocervical polyp also. So there can be multiple things at a time. Because it is psychosis, don't think that psychosis will come only with a single layer. It can be with multiple layers also. So any other questions? I hope I have solved the queries. And whatever is your feedback, please give it into the group so that, and all the females, please enjoy the motherhood. Keep guiding